Hi, I'm Dr. Shreya Soni, and I'm so excited to be here with my close friends, Dr. Molly Sears and Dr. Maryellen Tedeschi, discussing the most common hormonal concern for women, polycystic ovaries. So Dr. Molly Sears and Dr. Maryellen were my pillars through naturopathic medical school years ago, and since then, we have come together to fill a gap that we identified in the healthcare system. And together, we're on a mission to empower women with knowledge about how our hormones and how our bodies work. The syndrome known as PCOS has a number of symptoms. So if you are one of the ladies dealing with PCOS, you might be finding acne, a little bit of hair loss, or increased hair growth in certain areas, difficulty with weight gain. There could be darkened skin on the neck, and that's what the picture is of. That's known as acanthosis nigricans, and it's one of the first signs of insulin issues, so difficulty with blood sugar regulation. And the weight gain associated with PCOS, it's more of the apple shape, so it would be above your waist. A couple more things on this slide. Long term, if you don't start to address some of the symptoms here unchecked by the time you get to menopause, you're at higher risk of some of the consequences of this insulin resistance, which are hypertension, cholesterol issues, and even heart attacks. So the scientific community is not quite together on a consensus on polycystic ovarian syndrome. What we do know is that it has a wide spectrum of symptoms. But in general, there are signs of abnormalities to hormone levels, as well as difficulty with ovulation. This is an extremely common condition, like I mentioned, and it has been prevalent since even before Hippocrates. So Hippocrates is known as the father of medicine, and he even commented on it. So why has something that might be an impact to fertility lasted so long evolutionarily? And if you switch the slide, you can see that there are actually some benefits even to being a woman with this syndrome. The benefits being that elevated testosterone, you've got better energy from a survival perspective, especially back in the day, and that ability to collect body fat was even advantageous when we were going through periods of fasting. The reduced fertility doesn't mean that you're not fertile. It just means it takes a little bit longer to get pregnant, and that was actually an advantage back then. And even in some cases now, as we have smaller families, so women with PCOS have been there since the beginning of medicine, and we're still there. And there's actually there's benefits to having this type of hormone profile. The diagnosis of PCOS, there's a couple different criteria. The most popular one is the Rotterdam criteria, and your doctor is probably going to use this if PCOS is there as a potential cause of why you might be having hormonal acne or irregular cycles. And so any one of these items can put you on the spectrum of PCOS. So I myself discovered that I was on the spectrum for PCOS because I struggled with a cystic type of acne. It's one of the reasons I even got into naturopathic medicine, because when I had the cystic acne, I went to a dermatologist. I used antibiotics, and they worked for a period of time, but the acne came back. And in fact, I discovered some of the side effects of long-term antibiotic use. And so that wasn't enough for me. And I was given the option of birth control to control the hormonal acne. But again, that wasn't enough for me. So I dug deeper. I saw a naturopathic doctor, and I got to the root cause. And by doing so, I've really been able to improve my own health and reduce my risk for some of the long-term diseases. So like I mentioned, cardiovascular health is part of the picture here. So when you target one of the causes, blood sugar regulation, you're reducing your risk of cardiovascular health. And so you wonder, why me? Why do I have PCOS? honestly, back then it was because I consumed a 90s diet. I was a child of the 90s. I was raised on advertisement. So I wanted things like Pop-Tarts for breakfast, Coke floats, Starbucks Frappuccinos. And I didn't know that was bad for me. I consumed them on a daily basis. And then I wondered, okay, why do I have this acne? Now I know it goes hand in hand. Now none of that is part of my diet. But we didn't have that knowledge. We didn't have those tools back then. So things that contribute to why someone has PCOS, some of it starts in utero. Exposure to chemicals like BPA that's found in plastic is associated with a higher risk of having polycystic ovarian syndrome in the child. And other things are on your daily lifestyle perspective. So circadian rhythm disruption. I can tell you in high school, I was, and even college, I was pulling all-nighters. So that is going to contribute to PCOS symptoms, PCOS acne, inflammation. So consuming those inflammatory foods that I'd mentioned before, that is going to make PCOS worse, as well as not having a diverse gut flora. So the antibiotics that I was taking at that time, that in the long term would make something like PCOS worse, because the GI flora has a big role to play in your hormone production. Yeah.
Awesome. Thanks, Dr. Shreya.
Should be one more slide.
Yeah, there we go. It just froze on me.
Oh. Great. So long-term, like I mentioned, it is really important to address, especially going into menopause. So women with PCOS are at a 7 times increased risk of heart attack. So I'm Indian, I'm already prone to this, and I already have a family history of heart disease. So it's even more important for someone with my genetic history to be digging in and getting to the root cause of PCOS. Indian people are at a higher risk of diabetes as well. And it goes hand in hand. And I'm excited to have Maryellen, Dr. Maryellen and Dr. Molly tell you about how to treat some of these things at the cause. But if you have PCOS, you're also more likely to get reactive depression. So something that occurs in your life, you're more likely to respond with depression. Reactive depression is more treatable compared to genetic types of depression. I'm also at an increased risk of just responding to stress and producing more of the inflammatory markers associated with stress. And then long-term untreated, risk of cancer goes up. Specific types of cancers associated with the ovaries, as well as the endometrium.
All right, so I'm going to dive into one of the areas that we see a lot of symptoms come up for women who are experiencing polycystic ovarian syndrome, or PCOS. And it is called hyperandrogenism. So that is when we have higher levels of our androgens, which are testosterone, androstenedione, DHEA, DHEAS, androsterone, and DHT. And what are the signs that we're experiencing some elevated androgens? So we can get hirsutism, which is when we have hair growth on our face, our back, or our chest, and this is usually thicker, dark, coarse hair that's coming up. Acne, as Dr. Shreya mentioned, so cystic acne typically. And we can also see some hair loss, or what a lot of individuals refer to as male pattern balding. So these are some signs and symptoms that this is going on. Now, I wanted to bring up the pathways that testosterone is made and how it's involved with our other hormones in our body. And this is, for me and my practice, these are the two areas that I like to support testosterone, especially in women with PCOS. So first, I'll talk about our 5-alpha reductase pathway. So this is when testosterone turns into DHT. DHT is a really strong counterpart of testosterone. So this is when we can get, we see a lot more of that acne, hair growth, hair loss, things like that. So the enzyme involved in this pathway is 5-alpha reductase. So one of the ways that we can favor not making our DHT and kind of blocking this action of turning testosterone into its strong form is through herbs like saw palmetto. We can use reishi mushroom for this, nettle, PUFAs, or the polyunsaturated fatty acids. So getting a lot of those in our diet, and EGCG, which is it's found in green tea. And I'll go into some of these treatments in the next few slides. And then we also look at the relationship between testosterone and estradiol, which is one of our forms of estrogen. So our body can make estrogen through aromatase from testosterone. So sometimes, and it depends on how we want to treat here. So sometimes we want more aromatase activity. Sometimes we don't want a lot of aromatase activity. So this depends on your specific hormone structure, your symptoms, and what's going on. But that aromatase enzyme is what turns testosterone into estrogen. So if we wanted to, once again, if we had a lot of testosterone up here, and we wanted to favor this aromatase activity, we could use things like white peony or licorice root for that. Now, one of my favorite things that I wanted to bring up was spearmint tea. So using spearmint has been found as a significant anti-androgen in PCOS. So if we look back here, so especially with this 5-alpha reductase, we can use spearmint to nicely enhance the effects of these treatments here. So the saw palmetto, reishi, nettle root, to favor some symptomatic relief.
And I'll just add, so those herbs that you mentioned,
Mm-hmm.
I did use them, and I did find, my period improved, my acne come down, but they follow the principle of liver support. So they're not a long-term thing per se, but, while you're intervening and really hitting it hard, you do these herbs, they help your liver. And long-term, as you have a chance to fix your lifestyle and get some of the blood sugar regulation pieces, you may not need to be taking these forever.
Exactly. I'm glad you brought that up. And that's why we're going to have Dr. Molly talk about that blood sugar piece next.
Yeah. So this is a reoccurring theme in a lot of our webinars because it's so foundational to good health. So I'm reusing this picture from last week, and this is looking at that insulin release again. So just to review, insulin's going to be released when we're in the fed state to bring our blood sugars down. So if we're chronically stimulating insulin, either through, poor food choices like eating a lot of refined carbs or processed foods, like Shreya was mentioning in the 90s diet, you're going to chronically be staying in what our body perceives as a fed state. And so this is eventually going to lead to insulin not being able to function properly. And we're going to start to see chronically elevated sugars in our blood vessels, which is going to lead to blood vessel damage and organ damage. So some types of PCOS are associated with that insulin resistant picture. And I kind of want to pause there and explain that a little bit. There is not the best understanding of PCOS, like Dr. Shreya was talking about. And so just because you have one piece of the puzzle doesn't mean you're not on the spectrum of PCOS. So you can have PCOS and not have this piece, the insulin resistance piece. But if you do have that piece, along with that comes the type 2 diabetes, the increased cardiovascular risk, etc. And so if we go on to the next slide, and we start to look at specific treatments for treating insulin resistance, specifically in the population of PCOS patients, we see diet first and foremost being hands down the most important critical part of your treatment for that long-term benefit that, again, Dr. Shreya mentioned. So if we look at the basics and what the literature supports, we see that restricting refined carbohydrates is beneficial, following some kind of diet where we're being mindful of the insulin demands of food. So you can look at a food's glycemic index, glycemic load. There is something called the FID diet, which is the food insulin demand diet. That research comes out of Australia, and it's basically a way to time our carb intake so that we feel a lot less restrictive, but we still see a lot of the benefit that we get in limiting the refined carbs. And then increasing adequate fiber has also shown benefit in the treatment of PCOS as a dietary intervention. And this has the component of helping our blood sugar, but also adequate fiber can in itself support our hormone production, support, estrogen clearance, progesterone, estrogen balance, all of that good stuff. So we kind of get two benefits there. And then there's also some research that suggests in PCOS patients, some do really well eating a higher complex carb diet, which is definitely different than a high refined carbohydrate diet. But it's interesting to point out because it shows that, not one treatment plan is going to fit everyone's, individualized puzzle of health. So that's something to take into consideration. In the research there, you see that the high complex carbohydrate diet the patients were consuming more than 70% of their dietary intake as high complex carbs. And then the other side of that is others do best on a low carbohydrate diet, eating less than 40% of their diet in complex carbs.
And complex carbs versus processed carbs. So of course we know that processed carbs are our refined sugars, refined, breads and wheats and things like that.
Yeah.
Complex carbs are more of our grains, like our whole grains, quinoa, oats,
Our root veggies
veggies. Yeah.
And that's a really nice way to support the microbial diversity in our guts as well. So the root veggies really basically add as like a staple for the bacteria to kind of feed off of for longer term. So it can help that gut bacteria. So then next we're gonna, go into looking at specific supplement for PCOS, specifically that blood sugar piece. So Inositol, we also might have talked about in previous webinars, but it's specifically studied and shows great benefit in the PCOS community. So not only does it improve your lab work, so, things like HbA1c, glucose, insulin, etc., but it's also neat to see how that translates into physical outcomes. So this meta-analysis, you can see the supplementation with Inositol showed to be capable of restoring spontaneous ovulation and improving fertility rates in women with PCOS. So that just means that basically that component of irregular cycles has shown to be regulated with this supplementation that's addressing that blood sugar component, and also resulting in more pregnancies and live births as well, shown in other studies. And let's see. Oh, the other cool part of this meta-analysis was it showed that there was no relevant side effects recorded during this, analysis. But I do want to point out that sometimes people can, get GI upset with inositol. And also if you don't have that blood sugar issue and your insulin response is fine, this is going to cause hypoglycemic symptoms in you. So that might look like dizziness, seeing black dots, possibly fainting, but all those effects that you get with hypoglycemia can be seen if you're using this and don't need it. And then if we go on to the next slide, and we're going to talk about, a key staple in everyone's overall health, but specifically in the PCOS community, exercise is another foundational treatment. Specifically, the exercise types that were shown to benefit PCOS patients most was weightlifting and high intensity interval training. That's basically because those two types of exercise are going to result in more muscle gain. And so a foundational principle is the more muscle you have, the better insulin sensitivity we're going to see. There's obviously a lot of benefits that come to cardiovascular exercise as well. But again, focusing on PCOS, these are the types of exercise we see to be beneficial in the research. But we also always want to open that discussion that, movement can look like anything that's going to be easily incorporated into your life. You need to start where you are. So, starting with a daily walk is awesome, and it has lots of benefits. And then beyond that, in real life, we're not just looking at your PCOS as the only thing we're treating. We're also, taking into consideration your adrenals, your stress, your body weight, etc. And then we're able to specifically suggest better exercise plans for you. So that's that.
Yeah, and I just wanted to add about the insulin piece. So back when I was dealing with the cystic acne, we looked at some advanced markers of blood sugar for me. So not just fasting glucose, we looked at hemoglobin A1C, And mine was, almost pre-diabetic at 5.7, and now it's a full point lower, around 4.7. So, lifestyle does play that role. Other marker of my response to sugar, adiponectin, that was abnormal for me back then. So all these things do matter, and even with diet, it does get patient specific. So things like gluten and dairy, a lot of people are finding sensitivities to that aggravates the inflammation piece of PCOS. So patient to patient, you can test those sensitivities, or you can do a trial of removing those things from your diet and seeing if your acne or your period improve.
Exactly. And it's important too, like tracking symptoms and blood work together is really how naturopathic doctors guide their treatment, and to see if we're on the right track for you. So even, thinking of if we have anovulatory cycles or cycles where we're not ovulating, that can be due to those high androgens as well. So further, balancing and making sure we're supporting our estrogen appropriately, supporting progesterone appropriately, all of these things can certainly help and get you feeling better. Yeah.
And as always, we love hearing from you guys. We're all very active in our different social media and website formats. So keep sending us your questions, and we're going to use them to pick our future webinars.
Exactly. Thanks so much for joining us, guys. Hope you learned something, and we look forward to hearing from you next time.
Bye.
Bye.